All right. Hello, everyone. Thank you for being here. We're excited to introduce our project, Vax Connect, Bridging the Last Mile in Vaccine Access. My name's Jeremy. I'm here with Hannah and Alyssa. Today, we're going to walk you through a major healthcare challenge, the solution we've designed, and why we believe it can actually work. So let's start with the problem. Right now, more than 14 million children around the world haven't received even a single dose of any vaccine. These are what we call zero dose children, and nearly half of them live in Africa. The issue isn't that families don't want vaccines. The real barriers are distance, unreliable supply chains, and technology that just doesn't fit their reality. Caregivers sometimes walk hours to reach a clinic only to find that vaccines are out of stock. Many don't have reliable internet, smartphones, or even the literacy skills to use some digital tools, and the result is devastating. Preventable diseases like measles, diphtheria, whooping cough, these diseases still spread and take young lives. But here's the opportunity. If we can design a system that connects caregivers, trusted healthcare workers, and the supply chain in a smarter way, we can close that gap. That's exactly what Vax Connect is built to do. Vax Connect is a hybrid platform that brings together people and systems needed to make sure kids actually get their vaccines. Community healthcare workers who already have trust in their villages identify children who are unvaccinated. Families get reminders through simple text messages, voice calls, or even radio, tools that work even if you don't have a smartphone or can't read. Then, instead of asking families to travel long distances, Vax Connect will group households into small clusters, and routes mobile vaccine teams can directly reach in schools, markets, or churches. On the back end, the system makes sure the right vaccines are packed and ready, reducing waste and avoiding those heartbreaking moments when caregivers show up and are turned away. That is the essence of Vax Connect. Now I'll hand it over to Hannah, who will explain what is unique about Vax Connect and how it stands apart from what's already out there.
Thanks, Jeremy. So, what makes VaxConnect stand out? A lot of tools already exist, but most of them only focus on one piece of the puzzle. Some focus on reminding parents, others focus on tracking supplies, but very few bring it all together. What VaxConnect does differently is create one connected loop: demand generation, micro-scheduling, and supply coordination all in sync. The value is simple but powerful. The right caregiver with the right message at the right place and time with the right stock waiting. That is how you cut down on missed appointments, reduce vaccine shortages, and build trust in the health system. We've also mapped out our key stakeholders. The main beneficiaries are caregivers and their children. Community health workers are the linchpin. They are the ones using the app and building trust. Our customers are the one who would pay for VaxConnect, which are the ministries of health, NGOs, and donor-funded programs that already invest in vaccination. And then we have supporting partners like telecom providers who handle SMS and USSD services. And lastly, cold chain suppliers who keep vaccines viable in tough environments. Now, of course, we're not the only ones working on vaccine delivery. Organizations like Gavi, UNICEF, and WHO have done incredible work in cold chain upgrades and mobile outreach campaigns. NGOs like Doctors Without Borders bring vaccines to very remote areas, but these efforts are often fragmented. VaxConnect's competitive advantage is that it's integrated offline first and specifically designed for rural communities with low connectivity and low literacy. Now let's talk about how this is financially viable. Families don't pay for this service. They shouldn't have to. Our customers are the health systems and NGOs who have already budgeted for the immunization programs. In the early years, donor grants from groups like UNICEF or USAID will cover pilot costs. As we prove impact, we transition to government and NGO contracts that sustain the program. By year 5, we aim to have at least half of the costs covered through these contracts, while donors continue to provide catalytic funding. That way, the platform not only reaches more families, but also stands on stable financial ground. Now that you've seen what makes VaxConnect unique and how it can sustain itself, I'll hand it over to Alyssa to walk us through our 5-year roadmap and how we plan to prove this works.
Thank you, Hannah. My name is Alyssa, and I will be going over the financials, roadmaps, and closing us out. So here's a look at VaxConnect's financial projection and key success measures. In year one, we begin with a pilot in two districts. We'll train 150 community health workers and enroll about 5,000 children with funding needs of about $1.2 million, primarily from NGOs. By year two, we'll scale to two countries and four districts, expanding to 500 community health workers and introducing new app features. Funding raises need to be 2.5 million with support from probably universities and research partners. And then in year three, we'll expand to 12 districts, add vaccines like HPV, and reach over 500,000 children or 150,000 children. Funding needs increased to about 4.5 million, backed by regional tech vendors. And then we'll just continue this process through year four and five and just continue increasing children and healthcare workers and expanding in different countries. So the key metrics across these years will be cost per fully immunized child, benchmarking under $20 by year five. We want increased vaccine coverage among children and reductions in vaccine stockouts, which will directly improve health system reliability. And then for the next slide. So, is this realistic? Yes, we believe so. To make sure VaxConnect really works in the field, we'll start with the pilot and usability testing in rural Africa. This allows us to see firsthand how caregivers and community health workers interact with the platform. We'll rely strongly on partnerships with NGOs and ministries of health to align with existing systems and policies. Funding during these phases will come from donors and global health initiatives that prioritize vaccine equity. Finally, we'll use a step-by-step approach by listening to community feedback, improving the platform, and making sure it's built with not just the community it serves. And that's it. Thank you so much for listening. We'd love to hear what you have to say about vaccine access. And that's it.
Okay, I'll stop the video.
Do you want to forward one more because of the reference?